Time for our conversation this week with Dr. Isaac Bogosh, infectious diseases specialist at Toronto General Hospital. Dr. Bogosh, we always appreciate the time. I'd really like to start this week talking about Lyme disease. We actually had a guest on our program last week talking about prevention and protection from ticks, but I noticed this came up on your Twitter this week, so I wanted to ask you what you're seeing in terms of Lyme disease in this province, the severity and also the treatments, because there's kind of an anecdotal feeling in this country that perhaps we don't take Lyme disease as seriously as they do in other countries.
Yeah, that's a great point. Thanks for bringing that up. I would totally agree. We certainly have Lyme in Canada and, of course, Lyme in pockets of Ontario. You know, there's some decent surveillance to know where it is, but I think we have a lot of room for improvement in terms of figuring out where it is. We certainly have more ticks. And if we look at the number of cases of Lyme diagnosed in Canada year after year, the trend is definitely going up. I think there's room for improvement on many fronts. One is, from a healthcare standpoint, I think clinicians need to be more aware that Lyme is certainly present. And I think the general public as well should, we need better public education and information that there is Lyme out there, what to do if you get a tick bite, how to seek care. Because, you know, in all fairness, Lyme, you know, it's around, but it's not that hard to diagnose and it's not that hard to treat. We just have to make sure that people are aware about it, take steps to prevent it. If they have it, you have easy access to care.
Okay, that's good to hear. I appreciate that. Let's talk COVID, because, of course, Dr. Bogosh, we all sort of got introduced to you through the pandemic. So I want to bring you on to talk about that indeed. It seems many of us sort of, again, anecdotally, seem to know someone who's either had it or has COVID right now. Is there anything different about COVID at this point? Because I realize it's kind of dropped away from the headlines, the tracking, the data, that sort of thing. Or have we taken our eye off the ball too much on this? Or is this something that you're still continuing to see on the front lines, as it were?
Yeah, certainly there's a lot less COVID right now, especially presenting to hospitals as there were, you know, compared to earlier parts of the pandemic. But yes, of course, we definitely still see COVID in hospital settings. We see COVID in outpatient clinics. People are still getting this infection. We're not seeing as much of it, but it's still around. And sadly, we know that this infection continues to disproportionately impact older individuals and individuals with underlying medical conditions. You know, and I completely take your point that it has largely fallen to the wayside and people aren't discussing it anymore. But it is important that people are up to date on their vaccines, especially those who are at greater risk for more severe infections. So, you know, if people are over the age of 65 and haven't had a booster vaccine, it's certainly a good time to get a booster vaccine. It's not too late. And I think we're going to see probably a vaccine campaign in the fall, because there will be expected waxing and waning of this infection, and there'll be an expected rise in cases in the fall as we enter influenza season as well.
Got you. Okay, I want to quickly get to this because one of our viewers, Lori, has emailed us in. We used to have viewer questions all the time, but she wants to bend your ear about something. Lori's asking, now that many of us have had 4 to 5 shots of the COVID vaccine, is there a regular interval we should be getting them to keep our protection up?
So there's a lot of uncertainty right now as to what the vaccine program would look like going forward. Currently, it really is largely for those who are at greater risk of severe infection. You always have to ask yourself, what is the goal of the vaccine? It doesn't reduce infection as well as it used to compared to earlier variants of the virus. But what it does do is certainly help reduce the risk of more severe manifestations of the virus. And that's why those who are at highest risk for severe manifestation of the virus are still encouraged to get that booster vaccine.
Dr. Bogosh, always appreciate this. Thanks so much. Have a great day. We'll chat again next week.
Have a great day. Thank you.